COVID, it's not back, is it?
Well, there's a variant that's going around, and we want to know more about it. EG5?
Your Eris, E-R-I-S, is the name of the variant, right, Doctor?
Correct, correct.
Dr. Angela Nicholas, thank you for being here.
Who are you with now?
Thank you. I'm with Jefferson Health.
Jefferson.
I'm the Chief Clinical Officer of the North Region of Jefferson Health.
Oh, well, then you are a good person to talk to. What is this new variant?
Well, the new variant is just like some of the old variants, right? You know, the viruses mutate, as we've talked about over the months that I've been back here. The variant, the virus starts to mutate because it gets, you know, has new things that it wants to show itself because you become immune to it.
Well,
so,
does it mutate because it wants to stay alive?
Exactly.
It gets stronger and fight us?
Correct.
That stinks.
Yeah.
Is there anything that shows up differently symptom-wise? I know some people are thinking, oh, COVID, I already know. You know, we've been there, done that.
Right. Seems like the same symptoms.
Okay.
There's some concern that this strain is maybe a little more virulent, meaning that it is a little stronger, can get you more sick, but that actually hasn't been proven by the World Health Organization.
Who should be most concerned? Elderly?
Well, just like we've talked about over and over again, right? Those that are immunocompromised, your immune system maybe isn't as strong as everybody else, taking certain medications, severely ill, or have medical problems that make you more likely to get sick.
Give me a medication that would be a concern.
If you're on an immunosuppressant like prednisone or a chemotherapy drug or some medications that you use for skin disorders or rheumatologic disorders.
And of course, this is interesting timing considering kids are about to go back to school soon. We'll be back in close quarters with each other. I guess this means booster time?
It does mean booster time. It does.
When is that booster going to be available, though?
Well, the CDC is in the process of approving the new vaccine because just like the flu shot, when they make the flu shot to be to what they think the vaccine, what the strains of the virus are going to be, they've changed the COVID vaccine again.
Could it be weeks or
it's
months?
Probably weeks.
Weeks away.
It's probably a couple of weeks away, probably toward mid or the end of September.
And the flu shot should be coming out soon.
Flu shot's just about here. Should be available any minute now.
Can you do both? If you want to take your child and say, hey, let's knock it all out, can you do that?
Yes, you can do both.
You know, you look at these concerts that we've had all summer, you know, 75,000 people right at each other and singing and spitting and oh, that's why people think COVID is over. And a lot of people are running around here with colds. Oh, it's just a cold. It could be COVID.
It could be. It could be.
So we still need to test?
Well, you know, the virus is like the common cold now. And I think a lot of people get surprised sometimes when they think they have a cold or a cough or a runny nose or a sore throat, and it turns out to be COVID. But the good news is that many, many less people are being hospitalized. People really are not critically ill. There's obviously exceptions to every rule, but for the most part, it's like the common cold.
But hospitalizations are up just a little bit with this variant.
They are. We're starting to see a little bit of a spike. The numbers of COVID in the community were really at its very lowest in the beginning of July, and now we're just starting to see a little tiny uptick in both hospitalizations and in the virus prevalence in the community itself.
Keep us updated, okay?
I will.
Let us know when the booster's ready.
Okay.
All right.
I'll do that.
And the flu shot.